Dear colleagues, allow me to present to you my report on the topic Artificial Intelligence for Endocrinology, Collaborating but Not Deskilling of Doctors. A critical challenge that accompanies the rise of artificial intelligence in medicine, including endocrinology, is the potential risk for deskilling of physicians. Deskilling refers to the loss of a clinician's diagnostic or procedural expertise due to their over-reliance on automated systems for routine tasks, potentially diminishing the physician's ability to make accurate decisions independently. In the context of endocrinology, where conditions such as diabetes, thyroid disorders, and metabolic syndromes require ongoing clinical judgment, ensuring that doctors remain skilled and engaged in decision-making is vital. If doctors become overly dependent on AI, over-relying on these tools, they may lose proficiency in clinical areas of their practice, becoming less vigilant in reviewing diagnostic information that may lead to errors when AI recommendations are incorrect. Therefore, preventing deskilling requires a careful balance between automation and clinical engagement. One of the most effective strategies to mitigate deskilling, which is also helpful to improve patients' outcomes, is a very thorough verification of AI-driven decisions without blind reliance on machine outputs. This fosters clinical judgment when doctors can interrogate AI recommendations and predictions, remaining actively involved in the decision-making process, preserving their diagnostic and critical thinking skills. For example, evaluating AI tools that suggest insulin management based on the available scientific and clinical data, endocrinologists should evaluate whether the recommendations aligns with their clinical experience and patients' individual history, assessing patients' comorbid conditions simultaneously. Such differential use of AI as the source of guidelines-driven advices can help physicians maintain their expertise and confidence in managing complex cases. These collaborating with AI can balance the strengths of clinicians' professionalism, where AI assists by analyzing large data sets and identifying patterns, while the doctor provides the final interpretation based on their medical knowledge and understanding of the patient's unique circumstances. Another approach to preventing deskilling involves continuous training and education for clinicians on how to effectively use AI tools while maintaining their professional skills. Medical schools and institutions can integrate AI literacy into their curricula, teaching future endocrinologists how to critically evaluate AI outputs, interpret model limitations, and make informed decisions based on both AI recommendation and clinical experience. Additionally, ongoing professional development programs for practicing endocrinologists can ensure they stay up to date for both AI advancements and their clinical skills, reducing the risk of becoming overly dependent on technology. In addition, safeguarding of physician-patient relationship is essential in preventing deskilling. Endocrinologists are not only diagnosticians, but also patients' advocates who must communicate effectively with patients about their conditions and treatment options. Over-reliance on AI systems may lead to less direct patient interaction, which can erode the physician's ability to engage in patient-centered care. Ensuring that AI remains a tool to support rather than replace doctors in their communication and decision-making roles will help maintain the core skills necessary for effective clinical practice. Thank you for your attention.